right? And so I recommend you can try and talk with your case manager at your CCP and see if they can get in touch, but chances are you're going to need to ask the county, reach out to your county to get everything all connected together so that you can access that. And it's really good for you to have access to PEAK all the time. There's a difference between when you have to renew for the waiver and when you have to renew the base Medicaid. So those are similar processes, but there is different parts between your doing the CES redetermination and doing this Medicaid renewal piece. So the Medicaid renewal piece will have to be done every single year. And so you will have to do this at some point between now and April of 2024. So there's some date in there that you will need to do for both years.
Yeah, is your address correct? If your address is correct, I'd sit back and wait. But I would call the county to make sure your kiddos are still active because they're not supposed to be inactive.
And I've had families that go in there and they're like, well, I'll just do the application then since it shows they're inactive. And then the application kicks them back and says, no, this child already has Medicaid. So there's something that's not connecting right between the dots.
Okay, so reach out to the case manager and ask them for.
We need help. And we came with CCDC, we can help you. Or Grupo Vida, we can help you.
Family Voices, we can help.
Yes, is that
Okay, so call you guys on Monday and ask them how to get.
We can get you in touch directly with the department.
Okay,
Yeah.
I'm sorry, I'm having a hard time hearing. It's very echoey, so I'm trying to like listen really hard.
So we can get you in touch directly with the department.
Okay,
Healthcare. That will be faster and easier than connecting through the county.
okay. And who would I be reaching out for that?
It's in your chat. So either Family Voices Colorado. Or the Autism Community Store or Cross Disability Coalition.
Okay, thank you.
Rather than sending them to. Right, okay, all right. Other question, thank you.
Thank you.
Question.
What's the full question in the chat there?
Here we go. Okay. Okay. And if y'all could just talk one at a time, I think our folks can hear better.
Okay.
I just signed into PEAK as well, and it says, looks like you haven't applied for benefits yet. Let's get started. Now that's worrying since we've been enrolled since the fall of 2020, and I've signed in to this website plenty of times. Do you mean to contact your CCB case manager? I don't have any other case managers.
So when you've gone into PEAK before, you've been able to see your child and all their information in there, but now it's showing it's nobody. So sometimes you can have, like, I have 2 kids that are on waivers and I have 2 separate PEAK accounts, one for each kid, and neither one are for me personally because I'm not on Medicaid, but I have 1 account for each child. So you might be ending up with an account for yourself and not for your child. So make sure you've got the right account that's going to have the child. But if you're logging in with the same information that had the child's info on there before, it should still show up. I hate when the system doesn't work the way it's supposed to. You can also fill out a ticket in PEAK and say that, and they might get back to you. But again, we can try to help.
Yeah, and troubleshoot. Are there other questions?
Hi, yeah,
Go ahead.
sorry.
Go ahead, and then we'll take the one in the chat.
Sorry, I had a quick question. So I guess I'm not understanding the benefits of being on the CHP plus and having my own private insurance. If that makes sense.
If you have your own private insurance, you can't have a child on CHP plus.
Okay, but I do, like I have my own private insurance and I have them on CHP plus.
The panel here is saying it is possible. I'm saying it's not possible. I think he's on Medicaid and private insurance.
If you are in Medicaid and private insurance, you can.
Yes, you can have private insurance and then Medicaid is your secondary.
So, yeah, it's the Medicaid buy-in, right? CHP plus.
Okay, that's Medicaid, that's not CHP plus.
Oh,
They're similar, but they are different programs. So Medicaid buy-in gives you access to straight Medicaid with no co-pays, no out-of-pocket expenses. And you pay a monthly premium to access that. CHP
Oh.
plus is for that, again, that middle income families. But with CHP plus, you do have co-pays, not everything is covered, and it's not as comprehensive as Medicaid. So
okay,
they
so,
are different but similar programs. So CHP plus, you can't be on with private insurance. Medicaid buy-in, you can be on, and it's worth it because it will pay every single copay. It'll pay lots of things that private insurance denies, like formula, for example, or wheelchairs or home health. Yes, equipment and diapers and all those things that most private insurance won't cover. Medicaid will, so having that Medicaid buy-in will cover a lot of things that are not covered under your private health. So it generally
Okay.
is.
all right, that answers my question. Thank you.
Okay,
Okay.
so in the chat, we have, has the financial limit changed for Medicaid buy-in program? Would
Yes.
like to prepare if they will disqualify us.
It did change. So now the poverty level has breaks recently, in fact. So now, all you have to know is like, based on what I know out of memory. For one individual, Medicaid buying for adult is 132,000 now limit
One adult.
for one adult. Because your income is counted after that, not before. So what you get in the bank is what you count, first of all. Second of all, the way Medicaid buying calculates your income is 50% of your income is what counts. So you, in fact, let's say that you earn 50,000, you're in fact for Medicaid, you're 25,000.
But isn't he smart?
So is the answer, I was gonna type in the chat, like, is that yes?
So the answer is yes, it's changed. Who would you go to identify that change?
The Google there, yeah,
Google the federal poverty level
and calculate 450% of that.
and then calculate
450%.
450% of the federal poverty
And
level, because it's over the federal poverty level, and it goes by how many people are in the house. So if you have a family of 5, you need to look on the chart and figure out family of 5, and then do the 450.
I believe if you go on the website, you Google, children or adult Medicaid buy-in Colorado, on that site, they have a chart that says this number of family members, this amount of income, and just know if you are a little bit above that income, or even if you're close on it, still apply, because they don't take all of that income. They have all these calculations to determine how much is actually.
They call those disregards. There's disregards like for how much you're paying for childcare or how much.
Just be aware that sometimes the Medicaid website, Medicaid buying website is slightly out of date because the federal poverty level can change really quick.
Right. Okay, we've got a question here, and then if you have any questions, go ahead and put them in the chat or come off mute.
This is related to the income question. Are a home health provider, does that go against your?
It depends. So Magi Medicaid is calculated based on your modified adjusted gross income. So if you do not claim, if that is taken off of your taxes and is not included in your adjusted gross income when you do your taxes, if you claim tax exempt, then it shouldn't be included in Magi income. SSI, it kind of depends on who fills it out. Buy-in generally, it depends, and that's hard, and there's no clear-cut answer for yes or no.
Because the CNA money is not supposed to be taxed.
Yes, it is,
It depends on who you talk to.
exactly. So if you, for example, you are a living attendant for someone, that's when you can say, my income is exempted
But only on the Medicaid side.
only on the Medicaid side, exactly. And then it does not count.
Right.
But if you are not a living attendant, that income counts.
Because I am taxed on it, so I do have to back in taxes, but I saw on the application that there's a box that says I am a live-in provider for one or more children. So I checked that and I'm assuming that Medicaid then is not including that in our income for the household.
Right, but it's tricky because that only applies for CDAS and IHS. It does not apply for CES waiver.
Most families claim CNA as tax exempt if you're only a CNA for your living child. It is definitely a gray area because it says non-medical, but CNA is kind of medical, and so it's a gray area. I do know multiple families that have been audited and they've been maintained that their CNA income is tax exempt. But it is written for VDOT and IHSS, but we've been able to make it work for CNA as well because the IRS broke their rules. Not thinking about a CNA, parent CNA program in Colorado, so that
Yeah.
CNA really is. We shove it in the box, but it doesn't quite fit.
Yeah.
Okay, so they use some acronyms here and they're gonna owe me some. IHSS is in-home support services. It's another way of getting home health care under the children's HCPS waiver. The CDASS or CDAS as they call it is consumer directed attendant support. It also is a way to get home health care, but in the adult waivers. Now, in 24, all of that's gonna change.
Pretty high.
So just, put on your seatbelt and get ready for whatever happens, but we are gonna have consumer direction, which is what those two things are, in the children's waivers. Soon, like.
Or the state plan.
It's gonna go into the state plan, remember that triangle pyramid? All of those services are gonna go down into the state plans, everybody, yay, and you won't have to ask. So,
So
lots of things coming.
So in 2025, you can probably, not necessarily, but probably stop doing CNA and start doing either IHSS or CDOS. And then you'll clearly fit in the tax exempt bucket as far as I.
Yeah,
Okay, so next question. We're all ears. I have my hearing aids in and I put new batteries in, so I'm really on it. I think.
I do too. They're like,
They've gone out with popcorn.
I agree.
I'm gonna ask if anyone needs individual help that's on the Zoom call,
yeah.
because we can help with that.
They're recording, so I don't want any public.
Right, exactly.
Yeah, I don't want any.
We will not do that.
Okay, thank you. In other words, don't know those birthdays, ID numbers,
And
what you have on. Okay, yeah, we want to hear. What Anybody need an individual help? I guess they can put their name and phone number and we can always call it.
Yeah.
So if you want one of us to follow up with you guys, just put your name and phone number in the chat. What you have to ask.
Someone put a question.
Oh,
Can you
there's
scroll
a
up
question.
Oh,
Can you
sorry.
scroll up a little bit?
How do we keep the parent community connector past November.
Oh, Rebecca, you've asked the one question that I have to tell you, good and bad news. Here's, are you ready? Okay, you don't. So. So with the public health emergency, that flexibility was done under Article K. Don't even try to understand all that. It's all Medicaid.
Yeah.
But that flexibility is coming to an end. So I'm sorry to say that is coming to an end. However, remember how I said consumer direction is coming into the state plan? Well, that's happening under a thing called Community First Choice. And it's a federal flexibility that they're allowing the states to have. And with CFC, of course, CFC, that is going to go into the state plan. So as of, you said 25,
July 2025.
we will then have Community Connector be something you can do for your kiddo, as well as enhanced home care. Personal.
Well, so for adults, there will be all the services that are currently available in consumer directed CDOS, consumer directed attendant support services. And IHSS in-home support services will be allowed, and no matter how you access Medicaid, as long as you qualify for long-term. For children, IHSS as it is right now, so health maintenance activities will be available to anybody, no matter which waiver you're on, no matter how you get access to Medicaid, as long as you need long-term care. And then CDOS, consumer directed attendant support services, will be also available to children. What particular services are falling under that is still a little bit to be determined. It will definitely be health maintenance activities. Personal care will not be, so parents will still not be able to do personal care for children. Homemaker will be, but probably not, where parents will be allowed to do it. So there's a few things that are still getting figured out on what will be available, but more will be available, and you won't have to switch waivers to access any of that. You can be on CDS and do IHSS. You can be on CLI, you can be on SHRP, you can be on buy-in, you can be on income-based Medicaid and still access all things. Starting with the license.
Remember that CLI and CSC plus are getting,
Correct.
no, CSC.
Yes, yes.
CSC.
So CHCBS, the Children's
Yes.
Home Health, Children's Home and Community-Based Service Waiver, and CLLI, the Children with Life Limited Illness Waiver, are merging. Primarily because we're moving some of those things into the state plan, so we're shelling out, we don't need these two waivers, they can merge. So that's still going on as well. So you are gonna lose Community Connector, but you'll get it back.
It's gonna take some time.
Yeah.
We are still telling the department what to do because they are hell confused in this.
Well, they would know what to tell.
Exactly.
I'm starting to want to tell.
And that always good.
Yeah, I hope that gets back.
I know, right?
So, she says that, that we do have a question, but, she's gonna reach out. I'm saying she, I don't know why.
I think it was.
Anyway,
Okay.
okay, we've got another question
I
here.
had a follow-up question. So how does at-home respite services of individual and group respite, is that going to be impacted by these changes?
It will still just be available through CDS. That will not be moving to any of the other things.
Yeah. The
It'll stay the
CPF
same.
waiver is being left, what it is, yeah. There's so much happening at Medicaid, it's why it's, you know, all of us are here, because there's just so much one person.
Sorry, we didn't restate the question before that too. They asked, how does respite, is respite gonna be impacted or not for those of you on Zoom? And we said respite will stay the same.
Please send questions before.
Well,
We're listening for any other questions. We don't hear any brain stirring though, like. Wheels turning. We don't hear that.
And we don't use it.
Are there going to be any changes to the Colorado Baby program?
So the question is, are there gonna be any changes to the Colorado program? So that's an acronym. Health insurance buy-in is what HIBby stands for.
Which is completely
Yeah.
separate from Medicaid buy-in.
Yeah.
So they're
Yeah.
totally different, don't categorize them the same rate.
So the HIBI program or health insurance buy-in is if you're on a waiver or on Medicaid and you have private insurance also. Medicaid will calculate the percentage you pay for the individuals that are on Medicaid in your household and pay you back a percentage of that premium. Because it's cheaper to Medicaid if you have private insurance that pays more than 80 to 100%. So it saves them money out of their coffers, therefore they will pay for a percentage of that premium. HIBI is not changing. There's been nothing in our conversations with this department about HIBI changing. So right now, we're solid. Yay. Other than it is the best kept secret in the state. of
It is
Colorado.
the best kept secret, and that's what I told them. No, it's on secret.
That and non-emergent medical transportation, if you do not get paid mileage for driving your child to from doctor's appointments, you can do it. Also a best kept secret.
Okay, we're open for more questions. How many total do we have?
I have about 11 on the call, maybe 10.
Okay. Well, we're both waiting. Yes,
More
ma'am.
questions? I'm wondering if you have other best kept. Like this.
Oh, that's when my grandchildren call me honey. Oh, that's not what you're doing. Jose does.
So, in Colorado, we are implementing now a Medicaid for undocumented folks.
Yes.
It's called the All Covered Coloradans. And I am an ambassador for that program. So I'm helping set a few listening sessions and focus groups to help the state design that new benefits. And to begin with, is going to serve kids and pregnant women still without disabilities on Medicaid, full Medicaid.
Yay.
Yay.
I have a new one. The free COVID tests are ending in May. So it is time for us to all order the 4 per family that you can order for free, because that's stopping in May. So
Order them all.
I was gonna follow up on that, our local pharmacy at Walmart, you can actually get them in person through the pharmacy. You don't even need to go have a minute. Go in, walk out.
okay, so we were told that Walmart will give you the tests, they have them right there, so you just walk into Walmart and get the test. I went online this morning and ordered my 4, but I really, it's a free thing, we all want to take advantage of.
The only bad thing about it, and I do encourage people to keep an eye on this, they expire.
Yes.
But they don't, they are saying, look online, because even if they're expired, some of them will work.
Really?
Yeah, so there's a little thing that says, if yours is expired, check this information, so,
good.
yeah, so.
That's nice to know, thank you.
Yeah, it's kind of like cheese, unless it's fuzzy, you don't have to throw it out. But that was just a little known thing in my household. Okay, so what else is coming down the?
There's one more thing.
Yeah, go.
So, HIPAA for the Healthcare Policy and Financing Department has launched another ambassador program, and which is amazing. They're paying folks to participate in listening sessions and focus groups to educate the state on how to improve the Medicaid benefits. In Spanish, well, beginning in English, of course, in Spanish and in Vietnamese start with. And I am also an ambassador for that program. And I'm with a group of Villa, and I will be doing a focus group on that. Well, people are welcome whether they speak Spanish, English, or Vietnamese. if we have enough people in the language, we will have an interpreter. Actually, I'm looking at you. You're the only one I caught. Oh. So, thank you.
We have a translator here in the audience that is blushing, that is blushing. So, another little known fact is that the 100.2, which is the assessment for long-term care, talked about feeding, dressing, bathing, toileting, transfers, mobility, behaviors, and supervision. That tool is gonna go away, and they're implementing a new tool. It is very lengthy, it is very involved, but it's looking right now as if it will be it will increase access rather than decrease access. In other words, more folks through this assessment will be found eligible. A good example is we've done some babies under 18 months, and those are the ones that would be kicked out by the 100 points. They're going to qualify based on the needs. So it really is a great assessment, and ARPA funds, the American Rescue Plan Act, are buying the case manager iPads so that you will find out at that time whether you're eligible or not. So it's really going to be an improvement in the assessment. It's coming to a theater near you starting in May through October. They're going to be rolling it out. We're still identifying any flaws that are going on, right?
And many of us who are strong advocates in the community have been involved for 7 years on this.
Yes.
And then we have gone through 5 different versions, if I remember correctly. And the last one, we have fought to the nail to get every detail worked out. And then finally, last week, I felt like in the last meeting we had, they actually finally were speaking our language. And they were saying what we wanted to say, including in the rule and in the tool.
So things are coming along. They have to go to the medical services board to get the rule passed. All of that's in process, but if you think we just sit around and find on during the day to know we are paying attention to what Medicaid's doing so that we can make sure that it doesn't hurt any of the individuals we represent.
The other change that's happening is case management redesign. So you may have heard rumors about this, and so there are some very sad things that are happening with private case management agencies that do a really good job that are not going to be available to families anymore. But one of the nice things is right now, if you, depending on which waiver you want to apply to, there's a different person to send you to. So that's all getting consolidated in the next year, 2024, right? And so there will be one case management agency per region. And so that will be where you go to, no matter which waiver you want to access, that will be the place you go, and they will use that. So if you're already on a waiver, that you were going to get transferred if it's not the same agency that you're with right now. Some of them will be the same, some of them will be different. And so you shouldn't see a lot of change, but you'll probably get a new person at the new agency if it changes on you. So you might, if you work with Colorado Access right now, or you work with, that you might use Rocky Mountain Human Services, you might, you live in Douglas County, you've been working with Rocky Mountain Human Services, that may change who you work with, but it'll be essentially the same from the consumer end, but you might move case managers.
Yeah, Colorado doesn't make it easy.
And there are
because-
so many details that we're still working through with them. We are fighting to the nail to get them to include some flexibility in there, because we understand that sometimes people have issues with a certain CMN agency. And
Case management agencies.
case management agency. Yeah. I'm sorry. This is what I read and read every day. So I know more accurate, more acronyms than I can even count. I could make a book out of them. But so sorry, but the fact is, If we didn't get involved from the get-go, it was going to be really bad. And in some other states, these changes have resulted in what's called managed care, which is a freaking nightmare for families, for individuals, for people with disabilities, for all kinds of people.
If
We
you,
don't want that. That's actually forbidden by law in Colorado. Thanks to us too.
so, we don't make it easy in Colorado to figure out who. And we have single entry points, we have community center boards, we have counties, we have each county's there. We make it really hard.
And the
If
rate.
you really want to have fun with
Oh, the rate.
acronyms, we have an acronym list on the Voice website, and it's like 24 pages, and we translated it.
Oh, God.
So,
You guys
yeah,
are
and
fun.
most of that doesn't work. And most of those translations don't work, you know, anyway.
You have to tell me.
I'm going to elect a little bit, right, not politically, but.
I was like,
So,
okay.
I am. BHAs. BHA. We have some things like I work with families, you have kiddos, teenagers and adults. And we know the lovely inability to get care if you're in one bucket with CCP, trying to add the patient or whatever. If you have any wisdom, if you have any thoughts, if you're like, oh, can't say,
No,
that's fine
I
too.
can say, I can say something, Jose's twitching over here. but I
Please
can say
repeat,
something first.
please repeat it.
It was almost so-
I just feel sick there. So the question had to do with behavioral health agencies and what is happening and how you can get services. So in our state, the managed care of mental health is handled by the RAs, the Regional Accountable. There are 5 RAs in the state of Colorado. That's all gonna change, but
And that'll change,
yes,
so never
yeah,
mind.
so, but that's the way. So there is a thing under Medicaid called Creative Solution Calls. And the RAI is attributed to the individual's primary care. So if you live in Douglas County, but you're going to Children's as your primary care, you are in the RAI, you're still in the same RAI, you're in Colorado Access. Okay, so Colorado Access can give you a case manager and can do a creative solutions call, creative solutions. And that is for many in mental health, the first time the whole team comes together and talks. And the family has to be involved. And we're talking about kiddos that have multiple times of being put in the hospital in emergencies and holds. We're talking about the police coming to the house and the kid getting charges against them. We're talking about, but it doesn't have to be that bad, rather catch it early. It's starting to have behaviors and we want to nip that in the bud. The creative solutions through your RAIs, your regional accountable entity, and host those calls and start having the conversation. The school is on the call. The hospital, if the kids in the hospital or in a facility, the social workers, everybody's on the call. Talk about what are we going to do with this kid and where can we find services? And sometimes, you know, it isn't an easy answer. Sometimes there are more resources than we know about. It's really hard to know what all's available to a kid until we get everybody on the call and they're all divvying up a little bit of that. So I really highly encourage you to do those for kids. I mean, for kids and adults, you don't have to be any age. Right.
The biggest difficulty I've seen with them is when a family finds the solution or somebody that's outside of the rate, then they're very hesitant. It's like breathing through purple to try to understand, especially because they have the system set up to work with the rate. And they're a collaborative team, so that's the biggest thing I've come up against. But find, or if they find that they're treated I put in the rate, they're gonna prefer that. Had a family really pushed me outside the rate. Operated.
One of the other services that nobody knows about is called Momentum, and it's out of Rocky Mountain Human Services. But it is flexible money that can help with a case like what Suzette's talking about, where it's outside of the rate. But sometimes these families have private insurance too, so the private insurance has to pay first.
Yeah,
They're sticky wicket cases, really are hard cases, but we do them on a regular basis and we support the family through it and help everybody find the answers. And Momentum does have a long waiting list, but they're helping people that are homeless and don't have Medicaid yet to stay in a place rather than be on the street. They're helping some significantly folks that are in need. And they're doing a great job. So yes, they have.
Yeah, we have zero
Okay,
money.
I don't know what our timeline is. We're 2:15. Oh, gosh, I don't even need more.
Yeah, so if, I'm gonna release the Zoomers who want to release, obviously, thank you for coming. And call, if you would like help. I do have one person, like maybe right now, who would like a call. If one of you would
Yeah.
address that.
Is it for a kid or an adult? It doesn't really matter.
Okay.
Our contact, because I'd be happy to give like my name and my cell
Yeah.
phone address or contact.
Sure, I can do that. Here, put it,
Okay.
We're gonna put all of our contacts up in the chat. Caitlin, I'll be calling you, Monday. Monday sooner, it's an emergency, but it's been a wonderful event. Thank you, Autism Community Store, for hosting us and doing this.
Yeah.
We appreciate it.
Thank you for coming and for really all. For our family. Your presentation.
We must like it.
We must like.
Then realize how. That it's really.
There's a lot of behind the scenes, there's a lot of behind the scenes that goes on in meetings, in committees, in, gatherings and, one of the things, Voices does is we helps facilitate, children just go to the advisory gathering second Wednesday from 10 to 12. It's where a lot of these policy things get talked through, what's coming, what's the about, what all happens. So we talk about all of that. We have Medicaid as our partners on that, and it is sometimes in the weeds, but for the most part, we really focus on families having access as well as the manager. There's something just hit me. Under the American Rescue Plan Act, ARPA, there was an additional $10,000 given to anybody on a home-based waiver like CES that has home modifications as a part of it. So that extra $10,000 is going to end with the Unwind. So if you have a project that you need, doors widened, bathroom different, configures, whatever,
Ceiling lift.
that extra $10,000 can make that happen. Talk to your case manager at the community center board. If they say they don't know anything about it, call Family Voices and we'll find them if they do have it. We'll be nice about it, but anyway, but we want families to utilize that funding. And if you need a ramp, call Home Builders Association. They do blitzes, weekends where they do, 100 ramps all over the state, and it's all donated by Home Depot and Lowe's and all of that. So if you have a need for a ramp in your house, call Home Builders.
only if you don't qualify. Okay.
Don't do it either way. You don't use your whole lot, right?
Yeah,
Yeah, but I'm saying the insurance, right?
yeah, no, home builders just, and they do a great job. They did my daughter's second exit. Because community center board said we had to have a second, they wouldn't pay for it. So, so we had the home builders build us a second. For one.
Essentially, if you have unmet needs, if there's things that you said, man, I so wish we could get fill in the blank for my child. Talk to us, because we know there are so many programs within the state that if you know the right places to go and the right people to talk to, you can get
Yeah.
most things covered, and there's funding for most things somewhere if you know the right places to go.
Oh,
And I know,
kids mobility is doing adaptive bikes. They can get you an adaptive bike. You have one of your kiddos.
Or Two Angels Foundation will pay for them, or there's family support funds, or there's mill levy funds, or there's things out there for most things.
and even though you guys are focusing mostly, I want to also emphasize that for adults, there's also alternative
Yes,
resources out
Yes,
there.
there are adult reasons. Yes, ma'am. Wait a minute.
So that,
Yeah, are, you both are being so nice.
Question about partnerships. You know, I'm finished interpreting a lot of places. I go to 4 or 5 IPs. A lot of IPs, you know, about here. And of course, now that I'm doing interpretation, that that's just times for the show and tell, and I have all these problems. A lot of implications for parents, especially for parents that come from other countries, that we really are clueless, you know, about how your services work in the United States, how the system, not only your health system, but when you're very, very hard to navigate all that. Where is the problem with, why is that when I ask families, why is that mission like yours is that offer at the end of the night for a family that is struggling a lot, you know, I'm talking about this. And you just, you know, your heart breaks because you have a lot of barriers, you know. Starting with you left your country and you're out by yourself, and many times, you know, for especially for my community, I just, you know, I talk a lot about people that just because like you're speaking your language, and to ask another parents, you know, from your community, what is it you're doing? Because our job, why is that there is that lack of communication between, for example, educational systems with organizations, little organizations like you that do so much and help parents so much, because never, I mentioned sometimes 5 of them, they never have a clue who you are or what you do, and the teachers, you're surprised. What's happening there?
So you have.
That's the question. Yeah, I could, only one there. So can you restate the question?
Yes, so we have an interpreter in the room, and she's saying she goes to 4 to 5 IEPs, that just froze me a day. Because I couldn't handle just my own kids. And so she is going to all these IEP meetings, and she's wondering why organizations like the ones represented here are not connected to the education world for IEP, so that we can say to the family, especially those that have moved here and are no longer with families, things like that, they're just needing more help, and why we can't do that. It's a great question. It really is a great question, and we don't make decisions around it. One of my dreams is that we be able to connect with the school.
So let me take that question. In fact, the fact of the matter is that I could give you a whole day class this. But let's start with the basics. The educational system for adults is one of the most broken ones. And the reason, because every how you call them,
Special education.
no, district, every district
School district.
has autonomy.
Yeah.
So every district make their own need. And as long as CPP says yes.
Colorado Department. of Education.
Colorado Department of Education,
25 cents.
every time they say yes to their rules, the rules go. That creates more complexity in the system. Second, the rules in education are very different from rules in healthcare. The rules on healthcare are very different from other rules. Makes it almost impossible for organizations like our organizations to really do advocacy in education. So, for example, CCDP has said, no, we're not going to do it because it is nearly impossible to fight with them. So we do it sometimes when Medicaid is involved because then we have a need. Medicaid helps us get into the system, get into the board, get into the child's life. But our entry point is Medicaid. Because believe it or not, Medicaid is much better than the education system. Even though it's more complicated.
So Family Voices only gets involved in IEPs when it has to do with a medical issue as well. Or they're being denied services because the child has a disability. There, in our state, the ARC thrift stores fund the ARC chapters, and they will do one-on-one, go to IEPs and be a part of that advocacy. And Denver Advocacy Denver is the Denver based. I heard you say show and tell. One of the things Family Voices is doing along with parent to parent, show and tell, a group of VITA, ERP, and PEAK, the Parent Center. We are collaborating in a family coalition. So there isn't as much of this, word is bifurcation, but separation of all these agents. We are finding families due to COVID in the transition age, 17, 18, where they're not even connected to their community center board because nobody at the education, which once a year, is saying, plug in over here, your kid is gonna start transitioning. So it's a wish in Brigade.
Actually, you guys can do CCDC, don't like that.
Yes,
I already spoke to Elisa.
okay,
All right, I think just to follow up comments about what you were saying. One is what I noticed is because, interpreters are like a little flying people. We're just there looking at all the situation that we come in and go, right? And what I see is that many times when your organization show up for the meeting, is
No, it changes. Yeah,
sometimes I have a whole of lawyers there in the district because everybody's up in arms. Yeah, because it's like it should be looked like and I feel that maybe the second coming is maybe there's an opportunity there now that the districts are really craving for money. In DPS, with the gentrification situation that is happening, they are going like a lot of services are going. So, and I have the same question to the superintendent the other day. We were in a meeting, I was interpreting, and of course there were not too many people that when there's not too many people, I go like, can you ask a question? And I was kind of like, why is it that you don't go to all these organizations to help you with these?
Right.
They're willing to help.
Right.
And the questions sometimes are so I understand the questions that they think, but I guess right now, because they are so like, well, yes, but no. Like,
Most of the time, they will tell you the truth. The truth is that most of the time they don't like to talk to us because we'll make them do the right thing. And we'll make them pull money from the right places.
Yeah.
Instead of having to do what they want to, which normally is not the right thing.
So the translator is saying here in the room is saying that it's so frustrating because she wishes family organizations and the organizations here could couple with the school to help these. And yet, it's not encouraged. It really is not
And every
encouraged.
time she,
I've never seen a conversation table in an IEP with change with an advocate. Or a conversation at a table, if it's professionals, if you put a parent there, that conversation. So it's our dream, and that's kind of what we work for, is to get in and make some difference and help these families. Oh, you had a question.
My question was just, we're talking about the additional $10,000, under the American Rescue Plan, will that end, the end of the public health?
So the question is, will the $10,000 money go away with the end of the public health emergency? And the answer is yes. So I don't know the deadline of when you have to get that into.
I think you have to have construction completed by March of 2024 is what comes to mind off the top of my head, but I will look it up and get that for you for sure.
Yeah, so it is going to end at $10,000, and this is sadly not for children on the children's HCBS waiver, that doesn't help. It's for adults on CPS, or adults on SLS or EBD. Other learning disabled or supported living services, as we say, they do have adult into waiver charts. Staff waivers for everybody to not know anything. So, and for children on the CPS waiver, I don't think children with life limited illness has.
No,
almost not.
if you're life limited, you don't need a wheelchair ramp.
So again, there is money, and so if you have something that you're knowing you need, initiate it now with your case manager. Yeah, go.
Okay, one more, this was from the CCP support. It was about. We know that there are changes happening with, and then you talked about this. So we understand, or I understand, that you have to show failures with a couple of agencies before the parents will be able buy those services again. Jose, you're nodding, so I don't feel.
I don't know about this, so we're talking about CNA, certified nursing assistant, parents doing it and showing failures, there's gonna be changes.
they're gonna change, and we don't know all the details yet. But Donna shared with us, the one thing like Amy saying, that soon, North Hudson, parents are not going to be able, in some waivers, to serve as family caregivers. They're gonna have to show that the kid cannot work with their body, an outside attendant. And this seems very dumb. Sorry to me. But I'm having to talk to Julie Reskin, who is our executive director, see if we can go to the top level of this and see if we can find out why they're making this change. But Donna, our appeals director, is saying that there's no going back from there.
That, I mean, so
For
that
adults?
doesn't make sense, and it's for children, but it's not making sense to me because we're going to consumer direction.
That's what I'm saying.
So this is the parent, if they want to go to consumer direction, has to find a affiliate with an agency in order to get to consumer direction.
I'm not sure.
Okay, I've got.
There are so many.
I've got. This is, yeah.
So yes, we do.
No, my weather. No, my weather. Thank you very much.
Watch out.
I am a parent CNA for both of our children, both on the autism spectrum, but opposite sides. And I've been talking with my supervisor for the past year for our son, who's the oldest, who is incapable of brushing his teeth, is incapable of bathing, of dressing. And because his is behavior related, I'm not able to get additional help.
And it's hard, it's just So CNA, the rule for CNA is it has to be skilled care. And that gets really, really hard for these kids, and it is not fair to you at all, and part of what the advocacy we've tried to do. So for adults on IHSS, there's a program called, and in California, they have it for children too, that's called protective oversight. So you can get more hours for things like managing behaviors, but right now that is not available for children in Colorado. So all of these, whether it's through IHSS or through CNA, you have to justify why it's skilled. And that's different than personal care. So personal care is things like you are old enough that you should be able to brush your teeth on your own, but you're not. But anybody can come in and brush your teeth. Versus for CNA, you have to prove that it's a skilled task, that it's not just you doing something for them that they should be able to do for themselves, but there's some medical skill that you need to have to be able to do it effectively. And so when you're answering questions for those assessments, you really need to think about that skilled piece, that what do you do that is above and beyond what any person trained could do? How is this a medical task? Like for a child that has high muscle tone, for example, changing a diaper for a 2-year-old is not typically a skilled task, but for a child that has high muscle tone, where it's very challenging because you're fighting their tone and you need to make sure that you're not hurting them, then that changing a diaper could be considered skilled. So you need to think about how you can morph this into a skilled task rather than just, well, they are 12 and they need somebody to brush their teeth, so I have to do it. That doesn't count.
Okay, yeah, because our daughter, I do hours for dress. Of almost, so that must be higher.
But it's like a child is likely to choke while they're brushing their teeth.
Like she doesn't have.
You're right. Or medicated lotion, applying medicated lotion, things like that. Become skilled. Want to say something? Okay.
So I'm going to be here with me.
Okay.
I'm an expert on making things. You care.
Wonderful.
Yeah, I'm still hours and.
I was wondering if that sort of released what you were saying of, are they going to change it
They're going to.
to where then I'm potentially going to have to prove that that skill can't be done by 2 other agents.
Yeah, that's get tricky.
Okay, oh my gosh, well, I'm gonna get, I don't know what meeting that's happening.
I think I'm not talking. No, I need to talk to you about this.
Good.
Yeah,
He's talking about, Kim, Bim Stepper, we call her Kim Bim, the head of health department financing,
And she's coming.
and
She's in the,
and she's amazing.
Yeah.
Okay, yeah, Jose.
I met her. I told her one problem. He sent me
Jose
everybody.
says she's amazing.
He sent me everybody to help.
Okay,
And I got it fixed.
Does she know what
we only have one person up there and it's Gabby, so.
Yeah.
she works for us?
Oh, okay.
So.
I'm gonna go ahead and end the call if that's okay.
So, Gabby, do you have any questions before we say goodbye to you? And be right there.
Yeah, I'm sure way from the computer. Yeah.
We can just count. Thank you.
You're good.
She doesn't have to get it out of.
So right now, you don't have to do the prior authorization for your CNA still, so right now you're still okay. That the agency will still be reviewing, you qualify for, but they don't have to get approval from the powers that be to say yes or no, so it's just based on your agency's evaluation. But, and when do we unpause for?
Yeah.
2024, I don't know. Sometime next year, that is supposed to be where they